Good day, everyone. Tom Kuzma here with Buffalo Chiropractic Clinic again, here to talk about disc herniations. Disc bulges, slip disc, a lot of people call them a lot of different things, but I think there's a lot of misconceptions about what exactly a disc herniation is. So let's get into the anatomy here a bit first. We're just going to dive right in. So here's your spine. So you have your cervical vertebrae up in here, we have the lumbar, and we have your thoracic. Most common spots to find a disc herniation are in that lower back. L4, L5, L5, S1. You may have heard these terms if you've had a disc herniation, but real common just because you have the load of the body always compressing on these discs. So these are your vertebrae. We'll get right up there, vertebrae, vertebrae, vertebrae. In between each one, a disc. Now this disc, however, is not as healthy as this disc is, so it's a little thin and it's got this bulge right there. That is what a herniation would look like, on this model anyhow. So every particular person is going to be slightly different. Here's another representation of how the aging process works. So normal, healthy, starts to thin, getting a little bit rougher, starting to find these spurs. We call those osteophytes, but spurs, and then it becomes kind of a fused mess right there. But this process is normal. This is aging. This is what happens when we age. If we get lucky enough to be old enough to get to this stage, that's going to be good. Although there are people with early arthritis and conditions like that, but there are things you can do to help prevent it from getting to that point. In most cases, if you live to be 95, you're probably going to have some of that, but that's a good solid life. Aging, arthritis, these things are like wrinkles. Everyone's going to get it. It's just a part of life. But the things that we can help with here, another illustration of the vertebrae. So we have 3 vertebrae right there. Now, if we have a big force, if we have a lot of compressive forces, say you fall off of a roof, you land right on your butt. That squishes these things, and that can create these discs to bulge out, and that will compress the nerve. A lot of the symptoms you're going to feel are going to go down the legs. Sometimes you'll have bowel, bladder function problems. Sometimes you'll lose function of your feet. That's when it gets scary. That's when we need to get an MRI in order to see the extent of the damage. Now, that MRI is the thing I really want to talk with you about today, because at our office, when I see someone come in with a disc herniation presentation, we'll treat them first. Because most of the time, within the first few weeks, the symptoms are going to significantly reduce and they're going to function fine. So really the MRI isn't going to change their outcome of the treatment. So we try to avoid extra costs and just the stress of having to go in and have that done. So typically if you come in with a disc herniation presentation, we'll treat you for at least 2 weeks, because we know for a fact it's very safe to do chiropractic treatments for disc herniations, and it's also very effective. Now, to the MRI extent, this is a study that came out in 2019. It was published in Spine, which is a really high up there. It's a good journal that a lot of medical doctors will be looking at, and orthopedic surgeons. But this was a study done of 350 Air Force cadets, aged between 18 and 22. Of the 351, I think it was 351 that was in the study, 49% of them had a disc bulge. Now that's why I don't rush off and get an MRI, because a lot of times you'll have disc bulges, but you'll have no pain. So that's the main point I want to get across, is disc herniations are not the end of the world. You don't need surgery right away. Some cases you do, but come in, we'll evaluate, we'll treat you. Most of the time they get better within a month or 2. Sometimes it can take 6 months, even up to a year. But these things do improve. Conservatively, naturally, no surgery, no injections, no pills, just good old-fashioned living. So, disc herniations are not the end of the world. So come in, we'll take care of you. Thanks for your time.